I am Dr. Joanne Yanez, and today I have with me Dr. Shehab El-Hashemy and Dr. Dohn Kruschwitz, and I'm really excited for this webinar. So one of the reasons why we have this webinar today about changing careers is because very frequently we get questions from folks who may have had another career, or may come from a different medical background, and they want to know, wow, I love naturopathic medicine. This sounds exactly like what I want to do, but can I change careers? What does that look like? And so we have two folks with us who did that themselves. And so you're going to hear from both doctors on how they changed paths and shifted gears to become naturopathic physicians. And so with that, I'm going to turn over the screen. I'm going to mute myself and make my head go away. And so I thank you all for joining today and look forward to a great webinar.
Good morning, Dr. Yanez and everyone. Could you guys see us and hear us?
We can.
Perfect.
I do believe that I'm getting some background noise though. Do you have a fan still on?
It's off now.
Perfect. Thanks.
We are here in the lovely Portland. It's warm enough to have a fan. No, great. So good morning, everybody.
Good morning.
We're gonna take you through a little bit of an outline and maybe introduce ourselves and go through what I hope is an informative session about naturopathic medicine and how the journey was for two medical docs who moved into, or originally trained in medicine, who moved into naturopathic medicine. And we'll talk a little bit about advanced standing, and we'll talk mostly about philosophy and how things are similar and what things are different. We'll leave some room for question and answers, and Dr. Yanez will moderate. So we'll start a little bit about our stories and our journey. So I won't go through the entire detail. I grew up in Egypt. I went to medical school in Cairo. I was then moved to Canada, immigrated, and I did some undergrad in biology. I have a master's in education. I found naturopathic medicine serendipitously through a talk that a naturopathic doctor in Thunder Bay kind of gave. I am currently, just maybe fast forward, went to medical school, went to naturopathic medical school, and I was a faculty member for 13 years. I was an associate dean for about 10 years, and now I'm the dean at NUNM, and I love boats and water and sailing and stuff like that. I'll turn it over to Dr. Kruschwitz.
Hello, I grew up on a farm in Iowa. We produced all of our food essentially there. Our doctor was a chiropractor. I got my medical degree at the University of Iowa, and a residency in Iowa and a couple years in Puerto Rico. For about 18 years, I practiced in Iowa, general family medicine at the time, a little bit of everything, babies, surgery, and so forth. And in the middle to late 70s, I got interested in alternative treatments, which we'll talk about a little bit more in a moment. And this caused some problems with my partner, who didn't like what I was doing because I wasn't doing the standard medical approach for medical care for some of my patients. And this led to a separation from my partner, and then I spent 10 years in ER medicine, ended up at NUNM about 15 years later, and I've been here ever since. That's enough of that for now. We'll fill it in a little bit more.
I think so, and I think we covered the next two slides. Just a little bit maybe about Dr. K. You mentioned here you were a formulary board member. What does that mean?
I've been on the Oregon Formulary Board for over 20 years, and I'm actually the MD member of that board, where we approve what prescriptions and what drugs naturopaths can order in Oregon. So I've been on that long term and seen that develop from a somewhat limited to a very advanced open formulary. So, yeah.
The reason I asked is this is very interesting because this formula has been expanding for a while. The trend has been for allowing naturopathic doctors a fairly wide scope of practice, which includes pharmaceuticals as well. Okay, and you teach minor surgery, a class that I'm currently taking. So I'm refreshing my skills. I'm in his class on.
I wanted to say one thing about it. One reason that led me to naturopathic medicine was patients asking me about alternatives to conventional care. And I've told people before that I was open to that, which led to its occurring. You know, if I wasn't willing to consider that I didn't have all the answers, then that would not have progressed. But being open to that opened up this new world for me. Yeah.
Excellent. So we'll talk a little bit about a career change. So preparing for a career change is a significant step in anybody's life, you know, who wants to go back to school. So we both have done it. We both have went back to school. So preparing for a career change is, in our opinion, is kind of a three-step process. There's an academic plan, so kind of figuring out what and how and what the program looks like. Is it integrated? Is it not integrated? How much of my stuff that I've done before will be weighed in? There's a personal plan. Usually there may be relocation, there may be family considerations about how you manage this. In my situation, I moved from Thunder Bay to Toronto. So there's 1,500 kilometers, about maybe 1,000 miles apart. So there's certainly things to consider here if you're moving. And there's certainly a financial plan, how you fund it all, how you pay back your loans and stuff like that. And then usually you apply. So we're just kind of giving you a little bit of a taste of it. But if for anybody out there who's considering applying, you should really talk to your admissions counselor, who will really take you through all those processes. They're really helpful people and they're honest and they will tell you everything at the outset. So just a little note before we go into medical graduates and people with previous experience of any kind, like nurses, doctors, chiropractors, PAs, MPs, we just want to discuss the curriculum at a typical AANMC. So maybe I'll ask Dr. Kruschwitz to kind of explain a little bit the design of the naturopathic medical school.
Well, obviously there's the basic medical sciences you see listed there. That's pretty standard for most any medical school, I would say, with some special emphasis on our philosophy and so forth. And then in the third and fourth years, of course, that blends into treatment modalities from botanical medicine, nutrition, homeopathy, so forth, lifestyle. So the first couple of years are fairly similar, I imagine, in lots of ways to regular medical school. But then the thing that excited me the most when I came here was getting to explore and learn about these new therapies that I needed to know more about. And so there's a lot of things to learn here, new categories that are not in other medical schools, and so it makes it it's a pretty broad, expansive program. That's how I would say. Lots of opportunities to find what your heart really loves. You know, particularly it might be botanical medicine, it might be something else that really excites you when you start studying it.
Yeah, I have to echo that. It's fairly intensive because you're going through different paradigms, different traditions. We call them healing paradigms. And you really understand Western and Eastern concepts of health and disease and wellness. And it's really a time of blossoming where you kind of experiment and try under the watchful eye of clinicians with years and years of experience.
And coming from a medical background, figuring out how to blend that together in a useful way for each individual patient. You know, sometimes it would be mostly a medical approach because that's where they're at that point. And then adding some of these other modalities to help improve their situation. Just like any medical care, it's an individual process for each individual patient.
And maybe we'll be able to give
Yeah.
you an example at the end of how maybe we've done that in at least one exemplar case. So advanced standing, probably if you have any background, you want to know what of the previously achieved milestones will be honored, and will you have to do anatomy again? So these are questions that we hear a lot. And the answer is you could bank on some advanced standing. Every school is a little bit different, but typically the process, though, starts with meeting with an academic advisor. So either an admission officer or an academic officer from any institution. Contact the AANMC, see what there's centralized application, and then there will be somebody that will work with you. And they will start with compiling transcripts. We start with transcripts, so all medical school transcripts, undergraduate transcripts, any higher education really, and experience. And then we apply for advanced standing and see how schools are going to grant it. So this is going to be an individual decision for each school. But basically, you could bank on significant advanced standing based on competencies and outcome already covered. For example, foundational sciences. We say that with a caveat because some schools have an integrated curriculum, so they can't tease out anatomy from the functional stuff. So for those schools, it may be a little bit different because they don't have standalone foundational courses to get advanced standing. How much depends on the curriculum and what you're applying. So we're encouraging you to apply and see what you get. So we often get that question, and I would really like Dr. Kruschwitz to weigh in on that answer. I started with this. I said, this is usually a complex question. So people approach me and say, so how did you change? And I'm like, in many ways I haven't, and in many ways I have. There's some aspects that I do now, I'm in practice, and I do everything from medical care to naturopathic care and everything in between. So of course, clearly when I started, I only knew about medical care. So we'll take you through some of the differences, but I figured for this purpose, we need to talk about different career pathways. And naturopathic doctors are similar to medical doctors in the fact that some of them specialize and some of them stay in general practice. I'm in general practice here, so I see everybody. When I was in Canada, I had a focus on pediatrics. I still see pediatrics. It's probably half of my practice here, but I do see every other demographics. So I figured for our purposes, we're going to do apples to apples. So naturopathic doctor, primary care provider versus an MD primary care provider. So family doc to family doc type of a thing. So I'll start with the similar, and then we'll weigh in, and I'll turn it over to talk about the differences. So the patient experience, the patient will either way receive good diet advice, medical examination, diagnosis, pharmacologic and non-pharmacologic suggestions, counseling, preventative services like vaccines and whatnot. Difference. Dr. Kruschwitz?
Well, I'm going to go to maintenance first here, where it says a patient would expect sophisticated acute disease management, urgent and emergent infectious disease, direct hospital admission, in-hospital care, and more advanced thing. That's more of the medical approach to it. For instance, naturopaths would almost never typically have hospital privileges, as an example. That's just not part of the scope in most anywhere that I know of. As far as with the naturopathic care, as it says, transformation, we're hoping to make some changes. That was one of the things that drew me. Chronic disease that we couldn't get people better from or improve their situation, and with naturopathic medicine, we hope and plan that's going to be able to occur, that some of these chronic changes will improve and make life better for the patient. And so mitigating things, different kinds of lifestyle changes than would be maybe in the standard medical approach and so forth. So wellness optimization is a key there. We're looking for that. So here's a couple slides that will give a little more emphasis on that.
So we tried to give you kind of a philosophical take. So I took this from the American Academy of Family Physicians. So they pride themselves as defining the brand, if you will, as provides continuing comprehensive healthcare for individual and family. It is a specialty in breadth that integrates biological, clinical, and behavioral sciences. So you get a sense of the philosophical underpinning of what it means to be a family doctor in this slide. I figured let's contrast that with what naturopathic doctors kind of project. So again, you get some similarities and some difference. So you start to hear the same words, but you start to hear very different words. So we define what we do as a distinct primary healthcare profession emphasizing prevention, treatment, and optimal health. So you start to see these words, optimal health, through the use of therapeutic methods and substances that encourage individuals' inherent self-healing processes. So we talk about, this is kind of the heritage that we evolved in, is we try to maybe not address the disease head on, but we try to foster for wellness, and then wellness will take care of the disease.
I think it's worth saying too that we like to see if we can help discover what's really the cause of the particular condition or conditions that are occurring. And one of our favorite questions, what was going on in your life when this all began? And often that's one of the most revealing things, to discover how you might help to make a change, basing it on what caused it in the first place, perhaps, or at least made it, helped it to occur. So
a little bit about the paradigm shift. I think we captured that, but maybe what we want to say is we're not setting it up as better or worse. I think at different times you need different coaches. So we're saying here the paradigm had to shift for us to kind of start to open up to this naturopathic medicine. I was trained that diagnosis is priority. Precision in diagnosis is priority. We're not saying that an ND doesn't think precision diagnosis is a priority, but we're saying an ND probably goes into that healing ceremony emphasizing whole person care. In chronic disease, for example, people are seeking our help because there is almost a recognition that they want to live better, or they want to age better. There is interest in non-pharmacologic options. So building the conditions of health versus following standards of care. Again, that doesn't mean that an ND would not follow the standards of care. It just means the focus is a little bit shifted.
On the other hand, the typical patient that I would see in our clinic here may be appearing there because the therapies that they have been given haven't been working.
Correct.
And so they're looking for other possible alternatives, of course, which hopefully we have that work for them, and figure out what that is for an individual patient.
Also, from a personal experience, they may be more motivated than the average person because they tried something else and it doesn't work, and now they'll be like, this is serious, can I change my life? Like, it's a little easier to do a life change. So I'll share with you a case here, and it's fairly typical. So when we were rehearsing, we were discussing similarities in our practice.
Typical patient in my private practice, in the clinic here, very typical patient.
So I chose this because, first of all, it's a real case. So I'm following this case, and I can talk iteratively about it. This is not a case of rarity. This is a case of commonality. So I figured those of you who have years of practice will recognize that this is a pattern. We see a lot of cardiovascular disease, but it's not just cardiovascular disease. It's a life form that's going through life. And there's risk factors, but we don't just see that. We see everything else that's going into that life. So we're going to call this patient Steve. So Steve is 49-year-old. He's a carpenter, 5'7", 178 pounds. His BMI is a bit on the high side, and notable visceral adiposity. So this is, the belly is a little bit on the fatter side. Came in based on advice of a coworker who was helped by our clinic. So great, motivation. So what else? Why did he come for? He came for controlled hypertension. I say barely controlled because it was like 140, it goes to 150. And he was at tenolol, which is a beta blocker. He has prediabetes, a touch of stage 2 congestive heart failure. So that's when the heart starts to struggle during activity. It's a common side effect. There may be genetic predisposition, but having hypertension doesn't help. It usually makes it worse over time. The notable numbers, I'm not going to go through them, but these are troubling numbers. So if you see a waist to height ratio of a 0.57, so anything really above 0.5 is basically telling you something is wrong and it needs to change. A1C 6.5, that's not too bad, but we're going into prediabetes. And cholesterol is 190, HDL is 40, so that's low. LDL is 110, not too high, but the ratio is a bit off. Now we get into a little bit of knowing Steve a little bit. So his GAD-7 is 10 points. So this is suggesting moderate anxiety disorder. The reason I present it here is that that's part of the riddle. It's not cause, it's just the picture. So what do? What naturopaths usually do is spend time. So they spend more and more time trying to understand. We're not going to do something right away. We need to know how and what made the person the way they are, what makes them individual, and what will sustain healing if they want. So behind this, there was interesting food choices, working long hours, drinking a lot, social smoking, which is an improvement. He was a heavy smoker in the past, so now I guess he deserves congratulations. We still want them to quit, hopefully, but at this stage, we're just presenting the case at entry. Now, you could notice right away that they're anxious and irritable. They tell you that they're divorced and their life has been kind of disrupted by that event. They live alone, relatively sedentary, and I'm having a lonely thing. We get a lonely vibe. This person is alone. They feel alone. Now, a little bit of a motivator here. The father had first of 3 heart attacks at 53, so that's closer to his age of 49. So he's getting into the 50, and he's going to turn into that. So that's kind of why he came to the clinic. And his 10 years Framingham risk is 26%. So that's fairly high. So when you took all these numbers that we have in the first slide, plug them into a calculator, you come up with a risk. And based on the Framingham long-term study, this puts him at 25%, 26% of in the next 10 years having a significant negative outcome like a stroke or a heart attack. So that's very serious. So what I'm showing you here is the principles of naturopathic medicine and what we focused on in this person. And it doesn't mean that we didn't do the other ones, but it just plans. We try to identify and treat the cause, as Dr. K was discussing, and we wanted to do whole person care, and we employed healing power of nature. Now, therapeutic order, which is always kind of in the back of the mind of the naturopathic doctor. There's different versions of this, so we're showing you the one predominant version. And it looks like the Maslow's hierarchy of needs. So first, you kind of need shelter and food and whatever, and then you start to think about things like, why am I here? And then you start to think about self-actualization. So looking at it from the therapeutic order, there is really on the bottom of it, establishing the foundation of optimal health, stimulate self-healing, support and restore. So there is a system to what we do as NDs, and it may be a little bit more fluid than even what this pyramid is showing you. A little bit of a reflection on philosophy. So this is probably true for chronic disease. It's not true for maybe infectious disease and maybe most types of genetically induced cancers. And there are many exceptions, but we're talking about chronic, manageable, non-curable disease, like diabetes, for example. You can manage it by changing a weight. You can manage it by changing a lifestyle. Naturopathic doctors believe that health and disease are logical. They happen for a reason. They're purposeful. They're adapting to something, following certain laws. That is, it's possible to systematically determine root cause of disease. Disease is not random. So you're seeing some of the doctrine here that guides some of our initiatives. And that's why the typical naturopathic doctor in primary care would spend a lot more time on lifestyle change and finding root causes and motivating a patient to change. There's different ways to look at this. I'm not going to go through it, but you have the slide, so you can take a look at how we look at it from a different paradigm. So this case study, we considered a few things. So me and my team kind of looked at it from every aspect. So he needed some medical care. He needed to some evidence-informed medical care to optimize the pharmacology that he was receiving. So we did that. And then we considered a treatment for CHF. But we figured, well, let's see what happens when you change the other factors. Would it get better? Would it get worse? How much burden of medication or not medication? So you always look at risk-benefit. Investing time to figure out what makes this person tick, what makes them individual. So it's a big deal in our medicine to say, well, you know, everybody's different. The manifestation of disease in one person is different than somebody else. Resilience is different. How they embark on a healing journey is different. So I'll share with you a little bit more. So as we spend more time, and I'll discuss how many visits this takes. So this typically takes about 3 visits to kind of know somebody to that level. He wanted to look good. He didn't want to lose hair. This was a good motivator. He wants to visit family overseas. He wants to meet someone like a romantic kind of partner. And also he needs intimacy. He wanted to worry less, and he didn't want a bland vegetarian diet. He told us this from the beginning. Is that a typical patient?
Yeah.
So and this is good to state from the beginning that my approach, so this is in this case, my approach neither rejects conventional medicine nor accepts alternative therapies uncritically. I look at research for everything, really. So this patient we ended up putting on both drugs and naturopathic remedies. And you'll see, and if you do your research, a lot of that stuff has good published evidence. And we look at safety. We take matters of putting somebody on any substance seriously. And we have to be open to new paradigms, embracing broader concepts of health promotion, wellness, East meets West type of a thing. So we did what we always do, Dr. Kruschwitz. We focused on diet. So here's some stuff that was possible in this case. With a good investment in time, we focused on having a salad before every meal. That seemed doable. Mediterranean-inspired diets. Low salt, more lemon, low carb, more protein. Every step took effort. Every step took a negotiation, and every step took motivation. And this is where motivational interviewing, intentional interviewing, and a whole lot of skills that you learn in the naturopathic program comes in very handy. Lifestyle prescription. There was a no TV. Movies only, and no sleeping on the couch. So this person used to just lie on the couch and watch TV, and they would end up sleeping all night on the couch. That seemed to be an issue, because what are we doing on the couch? We're sedentary, we're usually eating chips, and we're doing a whole lot of stuff. Anyway, so we did weightlifting, walking on alternate days, Fitbit to 70% HR max, and taper smoking. So that looked like a lot of optimism here. So within about 3 months, we got this stuff instituted. Takes a bit. We're like, you know, and the health coach that takes time but delivers results. And pharmaceutical RX, of course, if you know this, that he wasn't optimized. So we kind of optimized it a little bit with diuretic and an ACE inhibitor. There's still a role for atenolol, but we wanted to see how blood pressure would respond to just standard of care. Botanical treatment, I'm not going to go too much into it. It is a very advanced skill that takes years to learn. But in naturopathic curricula, they're really experts at teaching you how to use botanicals and homeopathy and hydrotherapy and the rest of it. So in this case, that fit into the patient's what they're able to do. They like that they could take just capsules, and we used the botanicals. So the first one, just to maybe summarize, the first one is to address his psyche. So it's to give him a little bit of a more positive outlook on life and maybe stimulate self-healing kind of mechanism. So if he feels better, maybe he'll wake up in the morning and do the exercise. And the second one is cardiovascular focus. So all of these herbs really have benefit to the heart and cardiovascular system, and some of them reduce blood pressure, which is kind of an added bonus. So we wanted to condition that person. So about 3 45 to 55-minute visits to renegotiate and motivate. No progress until about 3 months due to compliance, and then a life event motivated. So a friend of his kind of fallen sick, and that was kind of the last boost that he needed to go, and he did wonderfully. We went with him. So at the end, we lost weight. BMI went into the healthy zone, and this is 9 months. This is not 6 years. This is fairly fast. More muscle definition, his hypertension is more controlled. Really all the numbers are falling happily. Again, we're not looking at cure, we're looking at improvement, substantial improvement of a life. And now we're not worried about diabetes anymore. We have better food choices, working less hours continuously. We still have to work, but there was a system in place where he takes regular breaks. Overall, less anxious, he's happy with the service, and I'm presenting that case because we see it a lot.
Very common case.
Dr. K, you've shared with me that in your clinical practice, maybe could you reflect on typical presentations that you see and that you saw in clinical practice?
Well, this would, one of the things besides minor surgery in the clinic, I did men's health and general health. So this would be a very typical male patient, perhaps a little older in a lot of cases, but diabetes, overweight, hypertension, and then anxiety was part of it. And then often erectile dysfunction was the other component that we learned about somewhere along the line. So all that went together. So the whole process, of course, was to start where they were and figure out the process of moving in the right direction, and not that you're going to get, as you pointed out, a change tomorrow or next week or next month. Just take a little time. And so this is a very common patient, and you can see some really nice results. Not every patient would choose to make the changes that were necessary. So a typical patient this would be. And
perfect. What I found inspiring is that this type of patient becomes an advocate. They're talking to everybody at work. They're bringing them in. They're really starting to look good. They're wearing, different clothes. Like it looks like a transformation, and that's what I love about this. I'm not saying that in my previous life in medicine I didn't see it. I saw it. But it's the frequency that I see it in, and then the impact, right? And this is something that we put together. So things that we wish we knew. So when we started this career, what can we tell these nice people?
Well, we've already alluded to it earlier. How about the finances? What's it going to cost to get the new training? Where do we go from here when that happens? And along with what we already said, moving for most people.
Yeah.
Our move was from Wyoming to Oregon. So, and then what kind of practice do you want? There's a lot of variations in that. About it could be a very similar practice to what you had before with new therapies and new approaches, or it could be totally different. And for me, I didn't know where I was going to be when I came here to school, and the universe said, we're going to offer you to be a teacher. And that was a new thing, an exciting thing for me. And it's been really nice for my third part of my medical life. So,
and you still do teach?
Yeah, I'm still teaching dermatology minor surgery. Yeah, part-time. Yeah.
That's fantastic. One thing I wanted to share is, people usually know what they want to focus on, and I encourage you to find mentors in the area. Some of the stuff that helped me personally is to reach out to people that I thought had similar interests early on, and they mentored me really into my career. And I encourage the same even before, like if you're contemplating, there's somebody in the area that you probably could contact and ask them these questions. How did you make ends meet? How long did it take you to pay your loans if you're going to take one? Or what kind of salary should you expect? All these things should be really discussed at the outset. So you're starting with an informed kind of set of data. I wanted to talk about specialty opportunities. Even in unlicensed states, naturopathic doctors do really wonderfully in specialty areas. We didn't talk today about anything other than primary care, but Perhaps we need to drop in recognition that people that focus perhaps on modalities or focus on demographics, they typically have a different practice. So, for example, there's a specialty group called the FABNO. So this is Fellowship in Oncology. So this is NDs that do significant training later on to do adjunctive care. So alternatives and supportive therapies during, before, during, and after perhaps surgery, radiation, and cancer care.
And here in Oregon, some of them are practicing kind of in their own practice. Some of them are actually in a hospital practice along with the formal cancer therapy group.
Yes, these are exciting initiatives
mixed right together with them. Yeah, so that's very exciting.
We have here in Oregon, we have a couple of shifts even for naturopathic students that work at OHSU. So they work alongside other practitioners, interprofessional care. The world is kind of opening up to these opportunities. Anyways, we wanted to maybe share with you a little bit looking forward. So what's our future plans? So here I'm going to continue hopefully in administration. I like administration. I also like clinical practice, and I have a career that allows me to do both. I also want to continue. I'm an author, so I published 2 books. I'm hoping maybe I can do a third in the next decade or so. And that's a little bit about me, Dr. Kruschwitz.
Right now, I'm an adjunct faculty have been for the last 3 years, and teaching in our dermatology minor surgery course, minor surgery labs and tutorials, and that's a part-time job. I saw patients for 49 years and decided it was time to slow down a little bit. But I love teaching. I love the new eager students. The student who said a few weeks ago, "I'm so excited, I'm going to learn how to suture." She just couldn't control herself, so that kind of excitement keeps me pepped up, pumped up, and knowing that they're really interested in being here. Every one of our students has a story, like we've sort of alluded to, and they're very fascinating, most of them. And they just about a good share of them have already been in 1 or 2 other professions, kind of like us in a way. If it wasn't medicine, it could have been some other totally different profession, and they ended up here, and they're very excited about it now. So that's what I find really interesting, the personal interest stories that you find.
Absolutely.
So I have no plans to stop adjunct teaching at this point. So.
That's fantastic. Maybe we'll turn it back over to Dr. Yanez for questions.
Thank you so very much. Would you mind advancing to the next slide really quickly before we start to take some questions?
Of course. This one?
That's it. So just if you enjoyed today's webinar, and we still have plenty of time for question and answer, just want to let you know about 2 other webinars coming up. So next month we have tips for eating mindfully. So we'll be talking about healthy nutrition and what steps that you can take to eat more mindfully. The following month is all about polycystic ovarian syndrome and painful periods and how naturopathic medicine can help. So for either of these and for any of our other events, please register at our website. And we also will have a recording of this webinar as well as all past webinars available on our YouTube channel and on our website as well. So hope that you can join us for future events. The next slide has how we can be reached for any questions. So if you have any questions, please feel free to reach out to info@aanmc.org if we're not able to get to them today. I see a whole slew of them coming in, so we will do our best to try and get to everything today. And there's also an 800 number as well. So let's see. There have been a lot of questions coming in about scope of practice and specialization, and I know that both of you touched on that a little bit. Would you mind maybe going into a little bit more detail on choosing a state or understanding the types of specialization that you may want to get into and how you find the place that will be right to set up shop?
Sure, maybe I'll start. I think the NMC site has a nice introduction about licensure and regulation of naturopathic medicine. And the trend has been for more and more licensure and more expanded scopes. And that's a fairly universal trend for other healthcare professions as well. So I encourage you to look at it. I think the last time I checked, there was broad licensure in about 22 states. And some provinces, and the other states still allow quite considerable scopes of practice. They just don't have full scope. I am here in a state where they really enjoy a fairly broad scope, and it had been the case for a while. So it really depends on where you want. So I encourage you to start with the website and see where you are, where you want to end up. You may decide to move to work, or you may want to stay where you are. Everybody's individual. What would you say, Dr. Kruschwitz?
I wanted to say that when we talk about specialization, depending upon where you might practice in what state, that term might be defined differently. In Oregon, we can pretty much have almost any practice emphasis that we wish, whether we call that specialization or not. It's probably a technicality.
Right.
We are not board certified surgeons or something like that, but we could specialize in women's health, for instance, or pediatrics, at least as an emphasis, while we still are general naturopathic doctors as well. A state like Connecticut, I understand, they're only considered specialists. And they're not generalists, which is kind of the other end of the spectrum.
Correct.
And in their health insurance programs, they're considered specialists that are referred to for nutrition or whatever things they might need from a naturopath. So there's a wide variation of that from state to state. Those are kind of the two extremes, I think.
So I think after you've gone through the broad discussion on the NMC website, if you already focused on one or two states, then I would encourage you to keep clicking on the NMC till you go to the regulatory link of that state, and there we'll discuss all that openly with you, and you can have an informed discussion.
Yeah.
Joanne?
Thank you. Sorry, I just had to unmute myself there for a second. So there's a question here from an MD who is having a hard time finding preceptorship opportunities with NDs. How did you manage to overcome that and convince NDs to take you on for training?
Well, in my case, since I was an MD already, I didn't look for MDs to work with. I'd had a broad experience there, so I was hunting for NDs to preceptor with. But it is a challenge to find preceptors.
Right.
And we've had sort of off and on again preceptors available, like in an emergency department at one of the big hospitals here in Portland. And then someone said, "How you can't let those naturopathic students go there." And so then it got cut off, and so back and forth. It's kind of an individual thing, kind of like who my friend knows Dr. So-and-so. Or people would go back home, wherever that was, and ask their family doc if they could spend time with them, or whatever kind of connection they can get. It's a work in progress, I'd have to say.
Correct. I can share.
You maybe know more about that.
I can share with you what we're doing here, and maybe what we did in Toronto, in Canada. So the schools generally have a system of support, and we say, of course, using your own network is always a great idea, because if you come from a place and you want to practice there, it helps to preceptor where you want to practice. So I'm not suggesting at all that leave it up to us, but we have a fairly robust database. It's all automated on preceptorship opportunities. So if you're a student here and in other places, you would get that, and at least it will give you a place to start. So like in this building, in this hospital, they take, and these students go and maybe introduce yourself, and there's a lot of material that's given to you and how you present yourself, so that so that people know you. People still don't know what naturopathic doctors are, and it takes a little bit of explanation. It's kind of a growing field. So there's a lot of support that schools will provide for its students and graduates to find opportunities for ongoing preceptorship.
Thank you so much. Can you speak? I know you talked to a little bit of the evidence base for naturopathic medicine, and Dr. Shehab, I know that this is a passion of yours personally, as well as authoring books based on the evidence base for naturopathic medicine. So would you mind speaking to the development of the research base as well as the existing research base for ND care?
Oh, sure. I think that was really my attraction to the field initially, as somebody who's medically trained. Does it work, and what works? And I think I took that even a step further. I involved myself into systematic review training early on. I was really into research. But if you look really at the footprint of every naturopathic college, they usually have robust research centers. And in those robust research centers, they really have high caliber research agendas. A lot of it is funded by NIH. They're funded by really state resources and really big institutions. And everybody's interested in what works and how it works. There is a ton of interest in healing in general and how you curb disease and whole systems care. So over time, I think naturopathic doctors have taken in a rich heritage of traditional knowledge and really have been self-critical over it and tried to improve it over time. So some stuff, for example, works but has some side effects. We do clinical trials and we find out what is safer. It's really not a question of whether you should use or whether you should not use. It's always a comparative question. Should I use this instead of that, or should I use this before that? So I want to assure people that a little bit of a Medline search or something over naturopathic modalities will yield fruitful results. Some of it is generated by naturopathic doctors, some is not. Some we call the integrative field doesn't just belong to naturopathic medicine. There's a lot of different players. The evidence keeps on getting better and better, and we adapt practice based on that. There is a lot in our programs now. There's evidence-informed practice is a theme. It's one of 5 themes here at NUNM, and I would suspect that it is the same elsewhere. We really are looking for, we live to find things that work better. And what do you know? Lifestyle change and addressing root causes, and this stuff has been studied. So we have in Canada and in the States, we have these big, large studies where whole systems care was compared to standard of care, and in pretty much every case, the evidence, and these are controlled trials with rigor and stuff. In every case, it shows that at least for chronic disease, a whole systems approach is beneficial. So I could share more, but I think people should look for some research. So for example, here at NUNM, we have HealthGot. If you Google HealthGot research, in Canada, there is also a center of research. So if you go into any college and look at the research department, they would list the type of activities that they've done over the last year and over the last decade. And I encourage everybody to look at those lists.
And that involves here, I know for sure, and I'm sure everywhere else, faculty members, residents, students,
PhD students,
all different levels of,
medical doctors, chiropractors, everything.
Yeah.
Thank you. Okay, so there is another question here about what undergraduate students or folks who are trying to, and I know you spoke about this a little bit with the preceptorship earlier, but what are some good steps for folks considering this to really understand the breadth of what NDs do, all of the options and career options as a naturopathic doctor? I know we have a page on career paths for naturopathic medicine, and it's one of our highest visited website pages. But I know that folks are always interested in what can you do? Can you do things like, what do NDs do for neurology? What do NDs do in specialty care and so on? Well,
a fair number of students have come to this medicine from personal experience with a naturopathic physician. They've for whatever reason or reasons have come under the care of a naturopathic physician, and this is quite variable, of course, of the practices, and that's not an uncommon story. You know, when I found it for myself, then it made sense. You know, I could, then that got me interested in doing it. Or they know the results that it gave to someone they knew, that sort of thing. That's one story that's fairly common, actually, and depending on where you live, that's a little more likely to occur in some states than others where there are more naturopaths available. But so that's one way that's common.
Yeah, so maybe playing off that, I would highly recommend that you first talk to an admission counselor or an academic advisor. They will be able to kind of figure out what your areas of interest are, and maybe link you with faculty members or NDs in the community that are serve as ambassadors. So these are people that are inspired about what they do. Most NDs are. They're quite happy with what they do. They want to share. I would highly recommend maybe a meet and greet, just discuss. So if you're interested in neurology, we have a few faculty on staff here that would love to share with you. We also have career days here. Every school has them, where this is open. We take you on tours. You get to meet the faculty and get to ask questions. You get to kick the tires, so to speak, and see for yourself. We have clinics. You get to see our operations, kind of look in the sanctum, what happens and how it's done. I think without seeing is believing. When you go and see somebody work and maybe question their methods and whatever, you may either come out with it with resonance or not. But I encourage everybody to connect first with an academic advisor and then with maybe somebody local, and we can help with that too. So schools can help connect you in the area of interest.
Thank you. Can you speak, we've had a few questions in about reimbursement and diagnosis codes. Do NDs use the same diagnosis codes? How is ND care reimbursed? So can you speak to that a bit?
Well, I'll just say we use all the same system, same diagnostic codes. There's nothing different from in any of the fields. It all crosses over, so everyone's using the same system. You know, we're all on computer system with all these codes, and so it's very universal, that part of it.
So yes, I want to preface this as we only speak for Oregon. So in Oregon, we have we use the same systems, even the electronic health records. We share that with local hospitals. We use the exact same codes, exact same systems. Reimbursement is relatively the same, although we're addressing issues of reimbursement on a daily basis, where some codes are typically in medical practice. There's usually pushback on certain codes, and why did you use that code? Why didn't you use that code? But the training, at least in Oregon, with coding is similar. So we say we have to call it the same. You can treat it differently. You understand the concept? So it has to be pre-diabetes. That is the only name, and that has a code, and that has a billing code, and that has a diagnostic code. You got to use those. How you treat it is, well, the world is now your oyster. How did we get there? Are we getting there because we're not sleeping? Are we getting there because we're not eating? These are different ways. Expect difference in different states. So in states that don't have full scope billing and coding, they probably will use a different system. So some states are cash pay, some states have kind of a hybrid system where you code and bill in different ways. I can talk to you about the Canadian way. We could bill what's called extended healthcare insurance, because everybody had their provincial insurance plan. So over there's one state insurer, the one payer system, and there's an extended healthcare. So think of the extended healthcare covered naturopathic services, and that you could bill. So it's really different anywhere. I think we give you a contrast. So it's somewhere between.
Yeah, and I think, you know, certain insurance companies will have more coverage for naturopaths than others, for instance.
Correct.
Depending on what plan of insurance you have, they may cover naturopaths better, you know, than another plan.
Dr. Yanis?
So I was going to add that the state associations are one place to go to find information about what's going on in a potential state of practice as well. they're the ones that know the politics and the laws and whatever's going. They know who the active members are there, and if you're interested in a particular state, just about every state has a association of naturopathic physicians, and they can find out from through you or through the national organization about that. So
absolutely, that's a great idea, Dr.
Yeah, that is a great suggestion, and we often will send folks over who are interested in various different networking opportunities and so on to the state associations. They are a great resource. Many of the state associations have conferences, and that is another avenue for students to start to wet their feet in the field and understand the type of continuing education that's available, as well as networking with potential future mentors or folks who can help you along in your education process. So one last question has come in, and I know we're just about out of time here, and there have been several questions about the variation in scope of practice by state as well as prescriptive authority. And so that is going to vary somewhat by state and within Canada as well. As will insurance coverage. And so it is best to check in with the state or provinces that you're looking at practicing to see the current scope, as well as any initiatives to work on legislation in those areas. So I know that is a common question we get, and what can I do and where can I do it? And that is constantly getting updated. I know in the last several years alone, about 4 or 5 states have had scope expansion or new laws written. So it's a really exciting time for naturopathic medicine. There is significant growth in the practice of naturopathic medicine. And so, you know, that is just one of the areas that we see that's really exciting.
And certainly in licensed states, they all are going to have a licensing board of some kind that you should be able to search and find, and the laws will be spelled out very specifically. Along with the help of the state association, but those are two separate things. The boards that control the licensing is a separate thing than the state association of naturopaths, but they work together very closely, and they know the scope of what each other's doing. So,
thank you so very much. So, do either of you have a last parting word before we close out today's webinar?
Yeah, I want to share with the world that I'm inspired about what I do. I think I tell people often with a tear in my eye, I'm like, I get to see miracles every day, and it's not that other people don't see it. It's just the frequency that I see, the transformation. I see families kind of healing, and that's a very rewarding thing. I told you I'm interested in pediatrics, and every child that eats well from the beginning is kind of a fantastic win for the world and the universe, and I get to be part of that. Dr. Kruschwitz.
Well, for me, I've told people, you know, this, when I finally found out about naturopathic medicine and NUNM, that was kind of like when my life kind of became complete. You know, the other forms of medicine that I was in were satisfying, but nothing like this. Now this has been kind of very fulfilling for me, and it's an excellent discovery and choice that I made.
And interestingly, to all of you who are watching, this is not a unique experience. This is common to a lot of practicing NDs. We're really enthused about what we do, right, the quality of life, what we're able to do in the world. And I think that's rewarding beyond anything else, really, that I can share.
Well, both of you, a heartfelt thank you so much for spending an hour with us, and all of your thoughtful pearls of wisdom that you've shared today. I really do appreciate you both taking time to hopefully inspire the next generation of ND healers. So thank you so much.